I don't think I have enough of us, though. Who else is missing?
Katie.
There's Katie. All right. I think I'm ready. Where's Elle? Is Elle here?
Sorry, but I was distracted.
Nasty.
I saw she was.
You have a pocket. I'm going to call this meeting to order at 10:07. There we go. I've gavelled with that thing. Can I get, Maggie, would you mind giving us saying the pledge for us this morning?
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, where are we at? Oh, Perla, can I get a roll call, please? Yes, I would love to turn your mic on. It's gonna be one of those days.
Freeman,
Present.
Berkowitz,
Present.
Costa, Dean Schlappman.
Here.
Hickey. Here. Mitchell. Butler. We have a quorum.
Yay. We have, number one, the approval of minutes from April 3rd.
Motion.
Motion Hickey,
Second, Dean Schlappman.
second Dean Schlappman. Can I get a nope, sorry, I have to have another roll call. Can I have a roll call, please?
Freeman,
Yes.
Berkowitz,
Yes.
Dean Schlappman,
Yes.
Hickey,
Yes.
Mitchell.
Yes.
Motion passes.
Thank you. New business, we have number one, the appropriating funds in the health department budget. Can I get a motion?
Move, Mitchell.
Mitchell, second Berkowitz. Is there any discussion? No discussion. Can I get a previous roll?
Previous, Dean Schlappman.
Previous Dean Schlappman, second Berkowitz. All in favor? Any opposed? Number two, Sunny Hill Nursing Home admission policy for non-Will County residents.
Motion, Dean Schlappman.
Motion Dean Schlappman, second by Mitchell. Is there a discussion?
Previous.
Previous roll Hickey, second Berkowitz. All in favor? All opposed? We have no other new business. We do have 4 reports. We have Sunny Hill Nursing Homes report. Is there any questions on that? And I thought I had one, but I don't remember what it is now. Maggie, you mind coming forward? Oh, I got to turn you on. I'm sorry. There you go.
Good morning, everyone.
Thank you. So, I was looking at the chart of admissions, and what I didn't see was, how do we know how many are out of district that we have right now?
We submit public health and safety report monthly. So I had actually included that information so it would give people an idea of like where
Oh, I see it now.
everybody came from, current residents by city at the time of placement and current resident family census. So we do that every month to just give us a general idea of where, our residents are, originating, and if they're out of state, if they're local, kind of that information is readily available. Those metrics are shared on a monthly basis.
I thought they were, but I couldn't find them, and there they are in front of me now that I've asked you that question. And did you get a good response with your peanut butter and jelly?
We got a wonderful response with our peanut butter and jelly. We have boxes and boxes, and actually this week we're having the Illinois food pantry come by to pick some of that up, and they're divvying it up to where it's needed. So yes, we appreciate it. I came by and I picked up a huge box of PBJ from the county here earlier in the week, and Chuck actually was very kind enough to assist me bring that out to my
Good,
car. It was
awesome.
pretty heavy. So we've had a truly wonderful response from everybody because we have it in our reception area. And as our families and visitors and everybody come through, they're just dropping stuff off. So we have peanut butter and jelly everywhere in our life engagement room right now.
I hate to say that's so cool. Does anybody have any other questions while Maggie's here?
Okay, thank you.
so much. Oh, I've got ink all over me. Elizabeth Bellato with the Health Department. Did anybody have any questions for Elizabeth? Because I do. I'm so sorry. Wonderful. I'm hoping one of those updates is cuts that we are expecting. Oh, you turned your mic off. If you don't mind leaving that on when you walk away, that'd be great.
Okay, so the very first part of my page report was in regard to the cuts to public health. So at this point, the temporary restraining order was supposed to be over on April 29th. So we have not heard anything. The only update we got is that the states have submitted supplemental briefing information and there's been no ruling yet. So I'm assuming that, well, that's a bad word to use. I really don't know what that means. So I don't know if we're actually extended or it hasn't been extended by that update from the state. So we're waiting to hear more on that.
So is it still the $7 million mark or?
Well, they were, according to what we were told, it was 11.4 billion. And then that resulted in 125 million that was awarded to IDPH. And to us, it was the one grant that we know for sure that was affected was our respiratory surveillance grant, which was $1 million grant over 2 years. So that's the one that we're waiting on for this TRO to see if they do continue to extend the TRO until there's a ruling. Then our staff are continuing to work. Of course they are, but we just don't know if we can submit it in a grant report for reimbursement.
Okay. And your micro pantries, it was some damage done. Did we know who did that?
No, I mean, the camera showed an individual knocking it over at 5 a.m. on a Sunday, but you couldn't identify who it was. And of course, we filed a police report. The county maintenance or the facilities department, they were wonderful. They put it all back together and it's back in operation. So thank you.
Another one is a measles update. I heard
Yes.
we have 2 in Cook
So-
County, which is a little bit too close to home.
Correct. So there was the one in Marion and yesterday, IDPH just put out a notice that there's one in suburban Cook County and one in Chicago. So that's all we have at this point that we know of.
Okay.
Those were my 2 updates too. Thank you for asking.
Look at me go. I think I had another one. I don't remember what it was. Does anybody else have any questions? Member Hickey.
Thank you. Just so I'm clear, how many of the positions at the health department are funded in part or in total by grants, by federal grants?
Okay, I can get you that spreadsheet. So we have a very elaborate spreadsheet that we mapped out because all of our grants end at different times. So we provided it to our Board of Health members at the last meeting. So some of our grants end on June 30th, some of them are August, some of them are November. So what we did for our Board of Health is we put them all in a spreadsheet showing the ones that we're most concerned about, of course, are the ones that are ending June 30th. So we also presented a plan to our Board of Health that if we don't hear from the grantors by June 1st, we've already had the conversation with the union on what would happen. So if we don't hear by June 1st, we're going to start looking at, do other community-based organizations provide these services? If not, then those programs we have to keep no matter what, and we have to use our own money. If other community-based organizations provide those services, then those programs or grants may have to go away, and we would have to send out the 30-day notice to the union members. So for this specific grant, the respiratory grant, there's 2 individuals under that, but there's a number of individuals, and I broke it all out on the spreadsheet by exempt staff, union staff, part-time staff, full-time staff. So I would prefer just get you this spreadsheet. So we're most concerned about the grants that end on June 30th.
Okay, thank
So
you very much. I
we can get
appreciate
that to
that.
you.
Thank you.
So I do have to say publicly how I was on a maternal health and morbidity task force through the NACO process that Cook County started, and you had 2 that were there. I'm going to No.
Cheryl? Picard?
Cheryl and Sylvia.
Sylvia Munoz?
They did an excellent job.
Excellent.
And I did send them an email, say thank you to you for providing those email addresses, but they did an excellent job covering our services. Things we don't have is a doula. And I know now is not the time to want to add anything,
Yeah.
but if we could get a doula, that would be.
Okay. I know that's on our
Because a
radar.
lot of our surrounding counties do have a doula.
Or at least an association with someone who has one that we can utilize through a referral system or something. So I did want to thank all of the board members that came to our MAP forum. It was very successful. We had over 70 individuals come and they, were weeding down to the priorities, and Caitlin is off. She took a couple days off after the forum. I know she was very stressed with that. So as soon as she gets back, she will be sending out what the initiatives will be for the next 3 to 5 years that we're going to focus on. But thank you to everyone that attended.
It was very good. Thank you.
Excellent, thank you. And I do have environmental health here. They were going to quickly go through the West Nile
West Nile
virus
virus.
presentation if there aren't any
And the
other
bird flu that they can't touch birds.
questions.
Go ahead and come on up.
Is that okay to bring them up?
Yep.
All right, excellent.
Good morning.
Good morning. My name is Kyle, last name Moy. I'm the program coordinator of environmental health in our Joliet office. So I'm just briefly going to talk about West Nile virus and our West Nile virus grant program. So our first slide here just gives a little background on West Nile virus. It is a vector-borne disease. As we all know, it's spread by mosquitoes. The cycle of the virus goes from birds to mosquitoes kind of rotationally. Birds are the amplified host, so the virus grows in the birds, the mosquitoes pick it up from them, and vice versa. Humans and other mammals, such as horses, are considered dead-end hosts. So while we can contract the virus, we can't spread it back to mosquitoes. Moving on, the next slide here just touched a little bit on our program. Every year, our season generally starts around May and runs through October. It is weather-driven, so a hotter summer, start to the summer, we might start a little bit earlier. Colder end to the season, we might end a little bit earlier. The program itself is run by 2 of our sanitarians, Erica Hildreth and Tiara Gavin. We have 14 traps set throughout the county. We run 2 separate routes. So one route's run out of our Joliet office and the other one through our Bolingbrook office. We have traps in Shorewood, Plainfield, Homer Glen, Lockport, Bolingbrook, New Lenox, Mokina, Frankfort, Crete, Monee, Manhattan, and Joliet. You'll notice that there are some villages and cities that aren't on this list. Historically, we had more traps that were throughout the county. We've broken down traps either that weren't producing or where other people have come in and are doing surveillance where we're not needed. So there's mosquito abatement districts, municipalities, and third parties that do surveillance as well. And then also the Illinois Department of Public Health has traps throughout the county as well.
I think our Forest Preserve does some as well.
Yep. As was mentioned earlier, we typically do bird collection to monitor for West Nile virus. This year, at the direction of Illinois Department of Public Health, because of the uptick in the avian flu, they've discontinued bird collection for 2025, and that's across the state. So all counties are not doing bird collection. Typically, if we were, we would be looking for perching birds, our first priority being crows and blue jays, and then second priority, house finches, sparrows, robins, blackbirds. Typically, and you don't see it up there, non-perching birds like chickens, ducks, geese, they can contract West Nile virus, but the reason that we don't collect them is because they typically don't die from it. So they're not a good specimen for us to sample and send to the state and as an indicator for the virus. Our staff, twice a week, they go out to collect the traps. So the picture you see, or pictures you see up there on the right, is an example of one of our traps that we set out. There's a bin that holds water. We put rabbit food in it, which kind of ferments in the water, which attracts the mosquitoes. We apply larvicide so that we're not actively breeding mosquitoes at our trap sites. And then there's a fan that's placed on top of it, which blows the mosquitoes into the net. Those traps are serviced twice a week, which could include changing out water, adding rabbit feed, applying additional larvicide, and then collecting the nets at each time. The nets are then brought back to our office for testing. Before we test them, they're frozen overnight. The mosquitoes are separated out. We're looking for the Culex mosquito, more commonly known as a house mosquito. The picture down below on the left-hand side is the male and female mosquitoes. We're specifically testing female mosquitoes because they're the only ones that take the blood meals. and that's required for them to continue to breed. With the testing, once the mosquitoes have been sorted, we put them into vials. BBs are placed in the vials with liquid media. They're blended up with a vortex and then we're centrifuged out. We sample the liquid. It's placed into the ramp test kit, which is a little small, it's hard to see the white and green little cartridge there. And then that after drying for 90 minutes is run through our ramp machine. That machine will then tell us if we have a positive or negative result. And then those results, if positive, are relayed to our director, Sean, our executive director, Elizabeth, myself and our other coordinators, the 2 West Nile virus program managers, our municipal partners. So where the trap is located, we notify them, and our media managers. That way, any press releases can be put out to notify the public. And then with our municipalities, if they'd like to, they can do additional abatement. So spraying, larviciding, whatnot. All results are uploaded to the Illinois Department of Public Health's web portal, whether it's positive or negative, and all positive results, once they're loaded into that web portal, go live to their website and anyone can see them at any time. So just an overview of our 2024 season. As mentioned before, we do public outreach through social media posts. We do outreach events such as the Will County Fair. We take complaints with regard to standing or stagnant water. If someone has an abandoned pool that they haven't used in years, ornamental ponds that aren't being serviced, just standing water on their property, we can go out there and apply larvicide if there's larvae present. With that, our program managers for West Nile virus, Tierra and Erica, at the beginning of each season, in addition to IDPH, provide larvicide training to all of our staff so that anyone can respond to these complaints and potentially apply larvicide. Last year, we tested 282 mosquito pools. Of those, 52 were positive. I believe all of our traps, with the exception of one, had positives. Last year, we collected 5 birds, 2 of which were positive. And those, I believe, were Piatone and Crest Hill collections. And then last year, we distributed larvicide, Alticid larvicide, to various municipalities throughout Will County. And this is typically applied to storm drains and catch basins at the beginning of the season, so around this time, to help reduce mosquito populations before we get into the season. Additionally, Will County Land Use, while they're not directly involved in this program, do a really good job at tire collections. They partner with, I believe, is it City of Chicago?
I think so.
Every year for a tire collection project, and then they collect throughout the year. Last year, they collected 3,954 tires. And this is significant because tires that, don't have holes drilled in them can hold water, and they are known to be a good breeding site for mosquitoes. And then lastly, fight the bite. So just recommendations for helping prevent being bitten when you're outside or in the spread of West Nile virus. So when you're outside, specifically at dusk and dawn, we always recommend using an insect repellent that contains DEET. We always say read the label. Typically, it's going to tell you to apply to the clothing and not directly to your skin. And then when working outdoors, if possible, temperature and weather dependent, we recommend wearing long sleeves and pants from dusk to dawn to avoid being bitten by mosquitoes. The other thing that can help significantly, especially around your homes, is emptying any standing water. So any kind of containers that you have on your property, whether it's planters, flower pots, pool covers, old tires, bird baths, kiddie pools, you want to make sure that you're emptying that water at least every 7 days. That breaks up the mosquito life cycle as they go from egg to adult, typically anywhere from 7 to 14 days.
I think in the training, they have a bottle cap. as
You wanna
a breeding zone.
Scoot or turn you on.
Even in the larvicide training, sometimes they show us that just a bottle cap, like from a water bottle, could be a breeding zone for mosquitoes. So anything that's going to hold stagnant water, if you can get rid of it, we're all better off.
Another common one too, just while we're on the topic, is cleaning out your gutters and downspouts, because a lot of times you don't think of that, you don't see it, but those will hold water too. They're dark, it doesn't evaporate with the sun. Those are perfect breeding grounds for mosquitoes too.
So I loved the faces of some in here when they found out that only females draw our blood. I already knew that. I sat in on a mosquito session a couple of years in a row at the Forest Preserve, and it's amazing what you can learn about mosquitoes. What is your advice to anyone who might see a sick or dead bird?
So we did receive, I'm glad you asked that. We are keeping our dead bird hotline active this year. So even though we're not collecting the birds, we still want the public to call. We'll be posting on our social media and our website with that information, and then we provide that at our outreach as well. Our recommendation is if it's under 5 birds, and this is from IDPH, there's specific steps. So it's wearing gloves, wearing a mask, double bagging the bird, and discarding it in your dumpster or garbage can at your home, washing your hands thoroughly when you get in, obviously not eating anything between that. If there's more than 5 birds, they recommend reaching out to the Illinois Department of Natural Resources, to their wildlife biologist for the area. And the wildlife biologist may, come out to collect a specimen.
If a human gets West Nile, what are the symptoms?
Typically, so it depends. West Nile virus typically affects, when you see symptoms, the young, the elderly, and immunocompromised. Most of the time, generally speaking, it's flu-like symptoms. A lot of people won't know that they have West Nile virus. In severe cases, it can cause encephalitis.
Does anybody else have any questions? Member Hickey.
Thank you. I only know this because I saw a dead bird yesterday on my walk. But I went to IDPH's website, which I realize you guys are not in charge of, but it still says that we're to contact the health department and have them picked up. And it gives all the criteria for what they need to be. Mine, unfortunately, was just a little birdie head, so it was not appropriate to call anybody about. But I just wanted to let you know that it does say that. So if people are confused, it's probably rightfully so.
We're anticipating
Oh.
those calls.
There you go.
Thank you. We're anticipating those calls, and we just want to let all our clerical staff know that we'll just educate the people as they call, because there is even with the 5 or more dead birds, if there's like a mass die off, there's certain steps that IDPH has recommended people to dispose of those birds. And there are some in the bullet points to call the local health department for things that we don't do.
Okay.
And we're just going to have to, we're prepared for it. We'll just try to answer their questions and limit the confusion for them.
Good. Thank
Because
you.
it is
very much.
frustrating. People just want answers.
Thank you. They want the bird gone, I think.
Well, that too.
Anyone else? All right. Thank you very much, gentlemen.
Thank you.
Dr. Burke. Next is monthly substance use initiatives update. Dr. Burke, I have concerns and questions, and this is regarding your Narcan. I understand that the federal government has cut the funding for the Narcan program. How is this going to affect us?
Yes, and that's one of so what I wanted to explain to you is kind of how my programs are funded, which will help give you a sense of what's at risk and what's not. So the office, me and Connie DeWall, are funded through an SOAR 2 grant. We did get an application. They are taking applications, so we're anticipating that we are going to still get that money. My pop-up folks that saturate the community, they are funded through the opioid dollars that are in the health department's budget. So the whole Department of Substance Use is funded through opioid dollars.
Okay.
Where we're at risk is the naloxone, because the naloxone that we get is from the state. They have a federal grant, but just got cut, where they provide that to us free. Now, as you can see on my, I pass out 15,000 boxes of Narcan a year. Those boxes of Narcan are at least $30 a box. So I have some IDPH funds that are for harm reduction and specifically for opioids. I'm going to use those dollars to buy Narcan as soon as they kind of cut us off. We just ordered some. They told us not to start hoarding, but and we're not hoarding. We usually order 3,000 boxes at a time. We ordered 1,000 boxes this time, just so we would have some. My biggest concern with the Narcan is that we have 10 red boxes in the community, and those need Narcan. I also have the ability to add more boxes, which was my intent right now. but I have to consider if we're going to be able to stock them. We have Cloxato, which is the 8 milligram. We had purchased that through a grant. I've got a lot of that still. So we have some backup there. But when I first started this job, we paid for our Narcan. So now we're going backwards. We're kind of, it is a significant change for us though, because as you see from the numbers, saturating our community with Narcan made a huge difference.
33%.
Yeah. So we'll start looking at making sure we target hotspots. We are not going to be able to go to every event like we've been able to do. That's going to cut back. I'm going to prioritize the red boxes so that they are available to everybody. And then if we do events, they're going to be special events like night out and kind of national events that are throughout the community. But it is absolutely going to be a challenge.
What about the training? Because part of that is our funds are for the training of the first
That's my
responders.
funding. That's, yeah. So I think the funding they were talking about, the police training, I think some of the police departments have their own grants. That's not my grant.
Okay.
My grant is through the state, through Supra, and that's not the one that's being
I just
affected.
wanted to be sure that our progress is forward going and that we're not going to be super hindered here.
I'm with you. I mean, we're going to do the best we can with the resources that we have and continue to make sure that the community gets the services they need, which is why we are very grateful for the opioid settlement dollars because we wouldn't be able to do it without it. So that's kind of keeping the game afloat with the other sort grant.
All right. Member Berkowitz has a question or comment here.
Thank you. I'm just curious, where's Narcan made? Is it made in the States or do we get it from China?
Actually, I don't know. I'm sorry. When we first bought Narcan, it was an Irish company that made it. Now, whether it is made, manufactured here, I can't answer that question, but it's that,
Could you get?
I can get that
Yeah,
information.
Who is the
Absolutely.
manufacturer? Maybe there probably aren't multiple manufacturers. And where is it actually made?
No,
Is
I
it
can
actually made, like in China? I'm
Right.
just curious. And then also, I believe Narcan doesn't work on every substance.
Only
there-
opioids.
Only, so does it work on fentanyl?
Yeah, fentanyl is an opioid.
Okay, but they have blends now. They've got, these drugs are being blended.
Anything that is opioid based, which means fentanyl, morphine, hydrocodone, those are all opioids. If they are mixed in any drug, say cocaine or methamphetamine, people will overdose and the Narcan works. So if there is ever opioid, Narcan works.
Okay, excellent. Now, is it possible to go to the municipalities in the county and ask them if they would be willing to help us with the cost of this program? Do we get any partnership with them?
No, actually, we support them because they don't have the funding to do the individual programming. And because the grant I get from the state requires me to work throughout Will County, that's what's funding it. And so that's how we've always gone by. This is just my opinion, think that municipalities are going to be in any better shape than we are when it comes to any reductions in extra money. And I don't think this is the place that they would probably offer up some of that money. I understand your point, but I don't think this is the right time.
Okay, thank you.
Annie, we have so many questions now. Okay, next up was seat number 4, which is Member Mitchell.
Okay, so just to let you guys know, manufacturing of Narcan has to either be in Massachusetts, Michigan, or Canada.
Thank you.
Those are their manufacturing locations.
Okay.
Now, where the ingredients come from, that's a different
Right,
story.
right.
Thank you for looking that up. Member Hickey.
So our Vice Chair Freeman, I think that it would be a shame to see all the progress that you've made be lost. And I'm just wondering, have you considered doing a foundation of any sort, a 501c3, that where people could actually donate to the program to make sure that it continues?
Elizabeth? No.
Sorry. Did I just go above your pay grade?
Yes, it is. That having a separate foundation for this support, if it was community-based, that would be different, but from this, yeah.
Oh, you want to turn yourself on? There you go.
So, I mean, we could look into that, but unfortunately, because the health department is not a nonprofit. We're
Right.
not our community health center is. However, based on the grants and the funding we get, it would have to have a separate fiscal sponsor.
Sure.
So, I mean, similar to MAP, how we have United Way as our fiscal sponsor for MAP. We would have to look for a fiscal sponsor outside of the health department. So.
Would you be willing to look into it, or is it something that could happen? I know getting a 501c3 takes a long time.
I think depending on how all of the cuts shake out in the next couple months, we would be probably interested in looking at lots of different options to fund our programs. So I don't think I would ever say no, but I think we just need to maybe wait a little to
Sure.
see, what actually happens in the next couple months.
Great. Thank you very much. I appreciate that.
Any other questions? All righty. Thank you, ladies. Is there any public comment? Public comment going twice. Third one, and we're out. Announcements and reports by the vice chair. Sunny Hill Nursing Home is having a county board tour Friday, May 9th at 9:30 a.m. in the activity room, Main Street. There'll be a brief presentation and a facility tour with a light breakfast to be served. Please let them know if you're coming. If you've never been to Sunny Hill and have never had a tour, I suggest that you go. You're going to fall in love with it. So, Julie, Member Berkowitz.
Hi, Micah, did we skip over number 3, or was I daydreaming?
The board minutes for the health
Yeah.
department.
Yeah,
I just kind of put that in there with her with Elizabeth, because
Oh.
did you have a question? Those are
Oh,
the board,
okay.
we don't approve them. They're,
okay,
that's the Board of Health.
all right, thank you.
Yep, thank you. So don't forget, Tim has made us a wonderful flyer. If you need him to make you a copy to take one home, to put it in your refrigerator so you'll remember. Am I making enough comments here? There you go. We need to go. If you haven't already RSVP'd, let Tim know. Does anybody else have any other comments? I will open it up. It's not on here and I think it should be. We have no need for executive session. I don't even think we have a state's attorney. Can I get a motion to adjourn? Move to adjourn. Mitchell, seconded by Costa. All in favor? Our next meeting is scheduled for June 5th, right here in this beautiful county board building. Thank you.